Well, hello, Alex. Welcome to the show.
Hi, thank you so much for having me.
And today we're going to be talking about the nervous system, which is one of my favorite topics because it really complements our work as GI focused dietitians. A lot of people we work with at Nutrition Resolution come in with real physical symptoms like bloating, constipation, food sensitivities, but they're told everything's normal, right? And one of the biggest reasons for that underlying is the nervous system playing a much bigger role than a lot of people realize. So I'd love to start with how you think about the nervous system in the context of physical health.
I actually don't even separate the two when we're working with patients. I think that what our mind, which is often what we think of as our thoughts and our emotions, is expressing is often, if not always, a direct reflection of what's going on in the body. And sometimes I think that the easiest way to think about this is instead of separating the two, so you're like, oh, I'm having this thought and it doesn't make sense, but it's weird. I have this anxiety and this recurring thought and maybe like a little OCD loop that you're stuck on. That goes to my mental health therapist. But then my bloating, my blood sugar dysregulation, whatever that looks like, that goes to my gut health specialist. I actually get curious in those moments about what the thought, say it's a thought loop, what the feeling and the need is behind that expression or that loop, and what the body might be trying to tell you through the only way that we know how to express things, right, is in words and thoughts. So if it's okay with you, I'll use an example.
That'd be great.
Um, yeah, so I like to use myself because then I'm not giving away any patient secrets, but I was the type of kid that always had blood sugar dysregulation, like from the start. And I have a whole gut health story that I'm happy to share, but this will just talk about glucose. I was the kid who had to get up, have orange juice or fruit or carbs, something. And this carried me long into adulthood. And when I finally figured out a way to support this after years of microbiome work that did not stabilize this, all sorts of things, I started a very low dose microdose peptide for metabolic stability. That was both incredible for stabilizing my glucose because it was a glucose modulator, but I also had another really unexpected symptom very promptly resolve, which is that I always had anxiety around scarcity and money. It didn't matter if I was making good money or not. I was always kind of like feeling like, oh, there's not enough. What happens? That scarcity. A lot of people, I think, have this thought loop. And it really was a bit treatment resistant in that it didn't matter what mental health therapy I did for it, and it didn't matter how much money I made. The thought was still there. Well, as soon as I regulated my glucose, because I knew from testing that what was happening is I had not enough glucose for how fast my insulin was responding. We talk a lot about insulin resistance in the inverse, but this was like there's just the insulin's actually coming really fast. I don't have enough glucose. And that's a liver thing. That's actually, an organ thing. And as soon as I fixed it, the scarcity thoughts went away. So, what I thought to myself is what generationally has occurred in my family history that made it so that, well, it's true, money buys sugar, right? And so, if you go through maybe it's intergenerational trauma through famine or through poverty, or we all have different things in our history. But for me, this feeling of scarcity was clearly directly related to my body saying, we don't have enough glucose, we don't have enough sugar. So regulating the nervous system strictly from a thought perspective wasn't going to work because these were very, very connected, if not the same. So when I think about nervous system regulation as far as a full body picture, I really want to take in the whole picture of what maybe the body is trying to tell us through these nervous system and thought expressions.
Wow, that's really, really interesting. And it makes me wonder if it's the chicken or the egg, though, because do you
Mhm.
think you did mention the family history piece or like a generational piece last time I spoke with you? And I want to get into that more, but I also wonder, do you think that maybe when your blood sugars are low, you're going to feel anxious, physiologically anxious? Maybe that's also just kind of the issue you would be gravitating toward feeling anxious about, or maybe a little bit of both?
I absolutely think so. And I've worked as a therapist in acute residential settings focused on mental health. And what I learned through those years of doing that is chronic symptoms like anxiety are not always able to be resolved through what we think of as nervous system regulation. And I think the point that I'd like to make clear is that it's all one body, it's all one system. And so the chicken or the egg actually doesn't matter. We have to come at it from a full picture. And the visual that I often have in my mind, because I often work at the metabolic and the neurological level for this work, is what's the upstream effect? So if the anxiety or the thought is downstream, we can regulate that. Like I had plenty of ways that I was still a very productive person despite this anxiety. I wasn't crippled with it, but it was always there. And so to me, that's the downstream effect. You think of water running. That's when it landed. That's when water hit the beach. But upstream from that, there was a physiological root cause. And so when we think about nervous system regulation, there is absolutely a lot of nervous system skills and emotional skills that we can utilize. And are we managing the symptom or are we correcting the root cause? And those can be a bit different. And this even happens for not intergenerational things. So, for instance, if you experience an acute trauma and it's a one-time trauma event that most people, that's how they relate to things like post-traumatic stress disorders. They think of one thing happens and then you have a traumatic stress disorder and that dysregulates your nervous system. Well, what occurred neurologically and metabolically when your body thought it was in such danger? It probably was in that danger on some level, whether this was acute violence or not. The body experienced it as something really scary. And so, what did it then put into place to keep itself safe? That is physiological as well as what we often think of as nervous system. So, a lot of the time we think of nervous system regulation as like your breathing exercises, your mindfulness, things like that. I support and love all of that. And if, say, the little receptors in your brain that control inflammatory response still think you're in crisis, you can breathe all you want. They're still going to make you feel like you're in crisis.
Okay. So what I think I hear you saying is there's an emotional solution potentially, or a like emotionally therapeutic solution, but that could run into a wall. So that's where we bring in maybe physiological support such as peptides.
Maybe it's a peptide, but maybe it's not. For me, this particular example, there was a metabolic component. So that's why I used that. I think what I'm saying is that it's all connected and we're all one body. And I really encourage people, I'm sure that you have your way of saying this, to validate what the body is telling you. And that includes your thoughts, right? There's not a huge separation between how we exist as people and how our bodies express themselves. So if we can take away that duality of what happens in your liver doesn't hit your brain, because I don't know about you, but I'm pretty sure my brain's running my liver. That's my understanding of the situation anyway.
Absolutely. And that's such a great way to frame it because I think the gut brain connection, there's a misconception. It's about stress, but your brain really runs all of the other functions. So wouldn't it make sense that if your emotions or if your thoughts are dysregulated or chaotic or stressed, that's going to affect signaling. And we know, those of us who talk about this, we know there's the vagus nerve, which connects the gut and the brain. So those feelings can interfere with signaling, especially as it relates to gut health. But yeah, it's so much more than just, oh, you're stressed or you're not. Because sometimes people will think, well, if my day's not stressful, this doesn't apply to me. I wasn't stressed that day, so that couldn't have been it. When it's really zooming out and looking at, yeah, but what's happening in the bigger picture chronically, what's happened previously, and maybe what have you trained your nervous system to continue doing as a default?
Yes, I totally agree. And I think for high functioning people, this is often missed because for people who are still operating at some level of success, the outcome often makes it seem like, well, you couldn't have much going on, or you wouldn't be able to be successful and operate at this high a level. And often, the reason that someone is able to operate at a high level is because of some of these dysregulations that keep them in overdrive. There's also a lot of really direct connections between specific bacterial overgrowth in your stomach. And there's strain by strain what the results may feel like. Does it feel like more anxiety? Does it feel like loss of motivation? We actually can get pretty granular, as I'm sure you do in your GI maps or whatever you're using to test microbiomes. In this specific strains overgrowth, this also goes to, I have seen this directly, that if you have, say, overgrowth or the correct amount of one bacteria in your microbiome, and then you maybe accidentally take that probiotic and add too much of it in addition, everyone thinks like, oh, that would be like cramping and gas and bloating. But I see very, very clear what is called mental health presentation changes, including depression, mania, anxiety, that very much could be accidentally diagnosed as a mood disorder when they're really an overgrowth of bacteria.
Yeah, yeah, absolutely. We do see that. Now, I want to get back to something that we spoke about in our earlier conversation. Two things, actually. I want to talk about the epigenetics and what happens in utero,
Mm.
because you mentioned both of those as far as predisposing us to what's happening now.
So, first, to define epigenetics in a way that feels accessible, if you think about genes, which we all have those strands of DNA, I'm sure you remember from elementary school, the little double HELOC. So, we have these genes. And when a gene is on or expressed, you can visualize it like a little light switch. And the light switch is on or the light switch is off. And if a group of people or an individual goes through a specific experience that requires a specific genetic expression. So, a really famous example of this is famine. If a large group of people go through the same famine, which is starvation, it may turn on a series of genes in that particular group of people that then get passed to the next generation as, this is an oversimplification, but as on, right? As the light switch is on. So now maybe 3 generations later, 2 generations, we actually do have some great long-term studies like this from known group traumas like famine or genocides where we can extrapolate like, okay, a couple generations later. And in the famine example I'm using, that's often referred to in Scandinavia, there's the expression all got on, and then a couple generations later, there was a ton of schizophrenia. And that's a great example of a group trauma then expressing in the genetics later on. So that's what we would call epigenetic changes. And then the second piece that you mentioned was in utero. That means what you're exposed to and what is expressed in your mama's belly. So whoever carried you, whether it's the person that raised you or not, that's the exposure, the environmental exposure that you had while you were in utero. So to come back to your question, how does this play out? You actually might be experiencing things in your world that don't even have to do with your lived experience, right? They feel like yours because there's expression in your genes, but they're not actually yours. They're not actually something that you experienced in your lived lifetime, but you might have inherited and feel in your body like you did go through. And that is the same when you have an in utero expression. I think what we were chatting about in our previous conversation is if, say, the person who carried you had a ton of stress, which I would say a lot of pregnant women, and we're all around millennials, like we're carried by baby boomers. There was like a lot of environmental stressors at that time. And so when you see a fetus exposed to, as an example, high rates of cortisol, we know that they can come out of the womb already with certain systems in their body. So one that you all can Google is called the HPA axis. It's really, really interesting. It does a lot of things with your pituitary and your adrenals. That can come out already dysregulated from what you were exposed to, both epigenetically, so many generations back, and you inherited in your genes, and then what the environment that you were exposed to in the womb. And so a lot of things that we're seeing, I mean, I feel like it's pretty common that millennials are like, we're all sick, like we all have something. I always think like, yeah, we're like downstream of a lot of environmental and epigenetic traumas. And now our bodies are expressing them, probably also because we're exposed to a lot of really negative toxins and foods. So it's accelerating those things that we were exposed to young. But that is directly connected to all the gut dysfunction and the auto and neuroimmune and all the things we're hearing a ton about right now can be often related to what was intergenerationally and then also in utero.
That's so fascinating. So it could be what happened to our ancestors or what our mom was going through when she was pregnant with us that our body's now expressing.
Yeah.
And let's just talk about what some of the ways are that can express. Because I know with our population, we see this at the root of a lot of IBS symptoms, could be diarrhea, constipation, could be abdominal pain, like just feeling hypersensitive to even for someone else might be a small amount of bloating, just feeling like pain. My trigger point is acid reflux, where that will flare up if there's stress. And when mine flared up, initially, I was just starting my own business. I was just starting a new specialty of gut health, ironically. And I mean, it was chronic, but I was under chronic stress. Like I could just feel it in my chest. So now I know. And really, I did all the things that I tell my patients to do, and it helped, but it was like holding everything in place and the baseline still wasn't great. So it wasn't till I addressed like basically what you're talking about, my emotions, how I feel from moment to moment. And that took practice that I was able to calm it down. And now it flares up occasionally, but to a minute degree of where it used to. But for me, it'll show up as a cough and I'll know that I need to pay attention to what I'm thinking, how I'm feeling, take some deep, slow breaths, that sort of thing. So what are some of the other ways you see this kind of manifest physically?
Well, so at my practice, we actually often have the people who did all of the things that you and I want people to do leading up to coming to us, and it didn't work. So, what you described was a beautiful example of connecting a physical experience with your emotional experience and then learning skills and practicing those skills so that you could respond and be more attentive to your body. I think that's just gorgeous. It's great work. And it's probably why you're helping so many people is that connection. At my practice, it's called Canary House because oftentimes we're getting the people who do that and it still doesn't work. And so they're looking even one step higher upstream. Remember, I talked about like as you move upstream, you moved upstream, right? You moved to the emotional anxiety stress place, and that supported the downstream impact of the acid reflux. For a lot of our clients, they are actually awesome and they've usually come to us with tons of testing already and tons of skills, and we're like the last stop. We're like the oh no, it still didn't work. So I will use an example that we often come across that's a little different just because if someone's listening that and they're like I do that, Alyssa. Like if they're already like, I'm already there, I want to give you some hope that there is actually some more upstream effects that we can find. So I used one example of glucose already, but there's also what we find very often is something called neuro-immune dysregulation. So you've heard nervous system and you've heard probably autoimmune, right? And it sounds like a combination of those two because it is a combination of those two. Autoimmune is when your immune system is focused on one system incorrectly and attacks it. That's a simple way of thinking about it. So you'll see like structural changes like in muscular sclerosis, MS, or you might see Graves' disease in the thyroid. Like this is all one specific system. Neuroimmune is when your receptors, and I could get really nerdy with the science, but I'm going to stay pretty high level. You can ask me questions if you want more nerdy stuff. The receptors in your brain that are in control of saying when something is a threat and when they're supposed to go and heal it get stuck open. They get stuck saying like there's always a stress. And so this could be from, like we said, epigenetic trauma. This could be from in utero exposure. This could be from one acute trauma or a complex, slower trauma over time. This could be from an illness that set your body and your brain into saying like there's something wrong. There's a lot of things that can turn the neuroimmune on and then, for lack of a better term, forgets to turn it off. Because if you have like a big cut, you want those brain receptors to send all those little cytokine soldiers and inflammation soldiers to the cut. That's why it turns red first, right? Like that's why it looks a little worse before it gets better. You just want to be able to turn them off. You want, oh, the cut's healed, we'll turn it off. Well, for a lot of our clients, they have been existing in a state with them wide open for a very long time. And that has usually expressed as both nervous system dysregulation, and I'm more likely to see, like you had a very specific, it's acid reflux. That's your sign. Our clients tend to be the people who have sort of like floating symptoms, like the pain is in their feet, and then the pain is in their throat, and then the pain is in their shoulder. And then it's fatigue, or maybe there's never pain, but there's always this like fatigue and then like a lack of caring about themselves, but they can care for everyone else. Like these are a little less clear than like acid reflux. You identified yours was one thing. So that presents as very confusing. And so a lot of our clients will go to a couple different specialists and they're kind of on the right track, but then it moves and they're like, oh my gosh, it's not in my gut anymore. Now it's in my head. Now it's here. And that's because those neuroreceptors are like wide open. And that can feel like also like anxiety. I actually have a client that we're working with right now who has a mood disorder diagnosis, bipolar 2, and she was fairly managed with psychiatric medications, but she still had some stuff that wasn't being handled. And we were able to identify the upstream stuff that was happening in her nervous system that we can now support that is probably causing the mood volatility, because that's like pain, right? When mood just sort of moves without you asking it to, that's very similar to like pain moving without a reason. And so this is where we get excited and we think, okay, how can we go further upstream? Whereas you, and this happens for a lot of people, we're able to say, this is the symptom and this is the connection. We also love that. I will say those are just not the people that end up at my practice.
Yeah, I mean, that worked for me. I
Yeah.
was super diligent about it. It worked for me, but for whatever reason, where I was seeing it show up systemically. I
Yeah.
mean, I had fatigue.
I want to say that's a good thing. We love it when it's just one presentation and someone takes action and changes it. But as far as like what else do we see, we tend to see mood, fatigue, and pain, and then sometimes like other sensations like tingling or burning or things like that, and then panic. So we'll also see panic that kind of moves through the day that doesn't respond predictably to psychiatric medication. It just sort of feels like it's not happening for a reason. That's another piece, and that's nervous system dysregulation. But when someone can't connect that to like a mindfulness technique or a traditional psychiatric approach, we start looking a little bit deeper into the nervous system. And usually that leads us to something like neuro-immune or metabolic instability.
So I think this would be good for you to explain as well. What are some of the things that you guys look at beyond conventional approach? Because there's a lot of people listening who maybe they've had standard
Mhm.
approaches and they're saying, why didn't my doctor find anything? Why is everything normal? But also maybe the people that you're talking about that maybe are like they've researched their issues a ton. Maybe they have had a lot of functional testing. What would you say, I guess, to each group? Let's
So,
start with, yeah, like when the standard tests come back normal.
well, I have an entire Substack called Everything Looks Good because I totally understand when you hear that. It is the last thing you want to hear when you feel bad. Everyone's like, oh, good, you had a good doctor's appointment. No, I want to know what's wrong. It's actually a bad thing when I'm told everything looks good. So the first category, which I think both of these categories fit together, in that if you either see everything looks good or what they call like inconclusive labs. So we get a lot of people who there are some things that are up, but the doctors don't read it as a pattern. They say like, oh, that's just like an outlier. Oh, you'd be having this symptom. So the first thing I would say is if someone says everything looks good, it might not actually even look good. It just might not be a pattern that traditional medicine is equipped to recognize. So the
Right.
first
They're waiting till things are extreme, right?
Yeah, yeah. I mean, if you look at how the lab results have a little line and then your number is in between, it's like a bold section of what's normal. I call that the not dead line, right? Like we're super glad to be in the not dead line, but it actually doesn't say feeling well. It just means you're not dead. So sometimes everything looks good because you're all within that line. Sometimes there actually are really atypical results, but because they don't organize in a pattern that is recognized as a diagnosis in traditional medicine, they're seen as outliers. So these groups actually become one group. So the pieces of advice I have are: number one, make sure that whoever you're working with understands how to read patterns and the relative proportions between the results. So to go back to my earlier example for myself, I actually was presenting with pretty severe hypoglycemia symptoms and fairly severe insulin resistance symptoms. But when someone would take my fasting glucose and fasting insulin, it would look okay. And it wasn't until you looked at them relative to each other that one is very different that they start to look like there's a problem. So the first is like, are you looking at the pattern recognition, or are you just looking at the output? The second, and all of this applies to both traditional medicine and, like, I order a lot of traditional lab serum tests, and I also order a lot of Dutch tests and GI maps and things that your clients are likely more familiar with. But there's also an indicator of how hard a body or a system is working to get the normal result. So if your results are within the not dead range, but you're not taking into account how much the body had to work to produce that, you can miss that it is a regulatory issue, not a structural issue. So you need to advocate for yourself that someone reads it through a regulatory lens, not an output lens. And then the third piece of advice I have is that a lot of the time these tests are being underutilized in that they give a lot of hints and information, but we're looking at them from, again, that output. So for instance, like in a microbiome, it's okay, yes, we need to understand the overgrowth, we need to understand the infection, all of that. But if you do that and you get it under control and then you keep having issues, we need to, again, look upstream and figure out why your gut is not self-regulating in the first place. And that actually may be, like we talked about earlier, it might be connected to the brain. It might actually not be connected to what you're eating or anything like that. The same on, I'm sure you have a lot of like midlife women clients. And so a lot of us have done Dutch tests that have beautiful amounts of hormone information. I often get people come in that have normal hormone output. And so they've been told that everything looks good. But the things that are missed are which pathways those hormones are taking. So is the estrogen taking an inflammatory pathway or the typical pathway? Is the dopamine being produced but not getting to be utilized? And then the one other little trick on those tests is sometimes they'll show metabolite acids coming out, and those can tell us a lot about what's actually happening in the brain. So even though you're not testing the brain, you're testing urine, you'll see these little metabolites maybe be raised that will tell you that, say, your tryptophan and your serotonin is off. Well, nowhere on a Dutch test does it say the word tryptophan, but you can infer some of those problems from the little metabolite acids that come out that are tested in your urine. So the third piece is, if you're not getting resolution from the results oriented discussion of your lab results, see if you can find someone that can read upstream. Like, why did these results happen?
Yeah, and unfortunately, that's just not how medicine as a rule is practiced
No.
today. It's very zooming in on one little piece or one little specialty. And so integrative is really what we need to look at, and how everything's connected. And I just love how you explained the root cause too, because we hear a lot about root causes and we talk about it too. But I always say, so from our standpoint in the work we do, root causes are things like imbalanced microbiome, insufficient digestive processes, inflammation. But I always say, if we want to look deeper, so maybe that's just under the soil. If we want to look at the deep roots, those are in the brain, and those are our emotions, or how we feel, how we process
And
life.
our stomach can certainly be a deep, I mean, I'm a girl who went through extreme leaky gut. I mean, this might not mean anything to clients, but you'll probably know. I had a zonulin level of almost 800, which zonulin is supposed to be under 100, and that is the marker for leaky gut. It did not feel good. That is absolutely something that has to be fixed. That came through mistreatment from the traditional medical community. I was given drugs that were very damaging. This was many years ago, but that has to be fixed first, because like if your gut is so permeable that all of this beautiful supplements that you're taking or everything else that you're taking just float into your bloodstream, you're not going to make any progress, right? So you do have to make sure that there are some structural things in place. The same thing, you can do all the gut healing you want, but if you are only eating McDonald's, it's not going to feel great. Like you have to give the bacteria the right kind of food to thrive on. So there are structural things that are really important. And the people that end up at my firm are often the people who have already optimized a lot of that. Like they're already doing most of that. There's usually some tweaks, but they're trying really hard and they've gone through the first 10 rounds of medical care. And so that's when we have to just be a bit more specific in what systems that we're looking at.
Yeah, yeah, absolutely. I couldn't agree more. And of course, we see that from time to time consistently. I'm thinking about a woman, she had a ton going on in her gut. She had hydrogen sulfide overgrowth, which is a very toxic thing to experience. So she was miserable. We were able to, quote, resolve a lot of that, but I could just tell her nervous system was still erect. She was still anxious about things. You could just feel the anxiety. It was palpable. And she's like, how long do I need to take my supplements? And I was like, well, they're holding you steady right now, the ones that you're now on, because we face through different things. But if we don't do something about your nervous system, you're just going to keep relapsing. And we do some basic nervous system education and work in our practice. But I think thinking of that person, that would be a great person to send to your practice to prevent this from just being a chronic relapsing case.
I think that's so wise that you're like, hey, we can handle the structural problems of this bacterial infection, all of these things, but there needs to be concurrent work. And for us, that would look like probably her working with either our complex trauma specialist or we have a bioadaptive regulation specialist. Both of those work within that anxiety and trauma. And then we would probably do some neurotransmitter testing and some metabolite testing to see if she also needs some medical support while doing the nervous system work with a trauma specialist. So this is not to say that you can do one or the other, right? Because most of us, by the time we're in our 30s, 40s, 50s, most of our clients are millennials or young Gen X. By the time you're here, you're pretty established in your patterns. So even if you do the nervous system regulation work with a trauma specialist, if your receptors are still frazzled, that you need support on that end. And even if you take that support, but you don't do the regulation work with the specialist, you'll just recreate, you'll force your brain back into it, even if your brain is being given some sort of modulator to support that. Some of our clients come in with psychiatric medications and we don't require them to go off of those. Most of them will phase off over time. Once we handle the root cause, they'll be able to phase off of whether it's antidepressants, mood regulators, anxiety meds, antipsychotics. Like we see all of that, but we're often able to get people off of those or at least off of some of them. And we're actually not prescribing those because we're able to work at a slightly different place. And so that's what I think you're describing is like, well, you can mask that anxiety and take an anxiety med and shut it down. But what else are you losing by doing that? Because you're not maybe addressing why your brain is constantly stuck in this hypervigilant place, which it sounds like this patient of yours is in a constant state of hypervigilance.
Yeah. And it's going to keep affecting your physical health,
Mhm.
even if you're masking the feeling. So it's like that
Mhm.
touching the stove analogy, right? Or pain is signaling something. So
Yeah.
you can just put on an oven mitt so you don't feel the stove, but the stove is still hot.
Well, my question would be, we do this both in a historical interview with her and then also some of this neurotransmitter testing. But my question would be, is her brain sending off flares that It's like searching for the problem to explain the reason those receptors are wide open. So you have to both give it some support in closing the receptors, which might look like regulation. These are neurological regulators, not psychiatric medications. Might be a medication to support that. But then you also have to do, maybe it's trauma work, maybe it's the regulation work. That's how we decide who you are seeing on our team on a daily basis. But that needs to also come into play so that you don't accidentally just put yourself back into it because of the patterns of behavior and the patterns of neurological response you have. So we're not separating the two, right? We have to do both angles. Just like you're saying, you can do all the gut health work, but if your brain is constantly telling your body it's in danger, it will just dysregulate your gut again.
Yeah, that makes so much sense. So I think the listeners really would appreciate getting into a little bit of the nitty gritty without getting too technical, so it's
Yeah.
just overwhelming. But can you maybe give us a few examples of like, what does this actually look like? What are some of the tools you use?
Mhm. Because we've been talking about nervous system, I'm going to start with a psychiatric diagnosis, if that's okay with you. So we've all heard of like major depressive disorder and like bipolar 2. Like these are like popular topics a lot. Bipolar 2 means you're probably not having like psychotic episodes, you're probably really functioning, but you're definitely having these like big swings in your emotional experience. So let's say someone comes to us and their primary concerns are, maybe they have a mood disorder diagnosis like this, they maybe have fatigue, they're not sleeping well. Usually they've looked at their gut, but maybe they have some gut dysregulation that's, like you're saying, like not really holding, not resolvable. Usually in that case, we would do a Dutch test that would test not just hormones, but how the hormones are being utilized, also neurotransmitters and also metabolites. So remember, the metabolites are the things that show up in your urine that indicate what your neurotransmitters are doing. So they're like, this is what the offshoot of, if you eat a big turkey and you feel that like tryptophan, we've all heard of that. Well, your brain also creates tryptophan without the turkey. So we got to know what the tryptophan is doing. Is it making you feel really happy, like after your Thanksgiving dinner? Or is it going down a pathway that maybe makes you feel like you're really powerful, but you're like, ooh, I got to take care of business. Like I'm constantly vigilant like that. Or is it going down a pathway that maybe makes you sort of like great at taking care of everyone else, like you're in crisis, but like totally not care about yourself? So those are all very real emotional experiences that we can actually attach to the testing. And we love to test so that we're not just guessing, because this is serious stuff. And most of our clients have had a million tests and they want tests that actually show them what is going on. So we would do that testing. In this situation of someone who has like a diagnosed mood disorder that's like mostly controlled with psychiatric medicine, but they feel like there's something else that isn't being resolved, a lot of the time that looks like either not being able to get to sleep or waking up at 3 a.m., like all these symptoms that feel like stress responses. So we do that testing and then we'd identify, okay, what's really happening? And in this example, like a lot of people would say like, oh, well, she's not sleeping well. She's waking up in the middle of the night. It must be high cortisol, right? That's really the go-to. What we actually found in the case that I'm thinking of right now was actually the opposite. She had low producing cortisol, but was using all of it really fast. So she was still feeling like she was jacked up on cortisol, but she wasn't producing very much at all. Well, that's a very different problem than, would just be expected from the anecdotal conversation, right? You would have said like, well, she's hitting all the high cortisol things. In fact, she was working with a trauma specialist on my team who said, I need to order this testing. I assume she's going to present as high cortisol. Very reasonable assumption, but she knows enough to test before she says for sure.
Especially because, in fact, the treatment then might be the opposite.
Very different in many ways. So if you have chronically high cortisol, we might be trying to work more in the regulatory space. What we were actually finding was it was the connection between the cortisol and the utilization that was low. And then also she had one of those markers that I mentioned earlier, two actually, that indicated, they have long, annoying names. So that's the nitty gritty we can skip. But she had two markers in her urine that showed that she was using some of these other things like serotonin and tryptophan in a like kind of like a survival way. And so that was actually making her feel pretty jacked. And that's why her body was using all the cortisol so quickly. It wasn't that she was producing so much of it. We're not surprised by it because we're the people that you bring in to be surprised. But like, that's an atypical, that's not what you would think if you just interviewed her. So that's when we go to the testing. So from there, for her, she's actually needed two things. This had been totally missed by all of her medical providers. She had severe ferritin deficiency, which is an iron test. And a lot of the time, anyone listening, if you've had your iron tested, look at your test results. If they only tested hemoglobin, they did not test enough. Make sure that ferritin is a line item on your testing. So she had very low ferritin. So we knew that iron repletion would help her energetic stores, would help her use the hormones. She's postmenopausal, so she needs the energy to be using what she's got. And then we also are using a medication called low-dose naltrexone, which is what will help her receptors take all of those things that are producing those survival markers in her urine and reroute them into the balanced place. So that's an oversimplification, but it basically is supporting your body to choose regulation. Our guest, she's actually been working with our complex trauma specialist for a while. And so we know her psychiatric meds quite well. We would bet money that she will be off or at least on a reduced dose of a lot of her mood stabilizers once she is at full regulatory dose of the low dose naltrexone, because now we've found that the bipolar 2 diagnosis is accurate in that it presents as bipolar 2. That's why she was originally referred to our trauma specialist. She hits all the diagnostic markers. It's not that the diagnosis is wrong. It's that no one asked why she was having that diagnosis. And in her case, there were also some gut markers that we're working on. It was not the primary issue. It was very clearly downstream. So she's still on some supportive gut supplements, but the up high is the brain receptors and the iron repletion that were deeply, deeply affecting her mood, really, because a lot of psychiatric medicines have side effects. So we hope that we can reduce those. And low dose naltrexone, once you're regulated, has basically 0 to maybe 1 side effect. It's very, very low impact.
Wow. Yeah, I love how simple you made that to understand and follow. And I just love how insightful and brilliantly you guys look at these things. So, do you want to share with the audience? Again, we kind of touched on it, but let's just bring it back around to like who that's listening would this resonate with and make them think, okay, they'd be a good fit for your practice. And then what does working with you guys look like?
Thank you for asking. That's so sweet. Well, first of all, if you're a high functioning, too strong for your own good, probably been pushing longer than you needed to push, and know that you feel bad, but also are still crushing it, that's our client, because that's the person who's often not served in traditional medicine because they're like, well, you're running a business. A lot of our clients are high-powered professionals. They're running businesses. They're crushing it. They have families. They're doing everything. And I would say if you have pain, fatigue, tingling, numbness, anxiety, panic, depression, things that kind of like don't match with who you are, like if you're eating well and still gaining weight, or if you're lifting weights and still in chronic pain, or if the pain isn't always in the same place, like that's who comes to us. Or if you have like 8 million specialists and no one actually knows how to diagnose you, so you have either no diagnosis or like 30 diagnoses, but no one is actually treating you, both of those would fit with us. So I always say, if your lab results are stumping people, you're our girl.
So many people.
I know, it's so many people. And we also work really closely with providers like you. So if you have a provider that you love already, this is not an either or situation. If the provider is willing, oftentimes we'll come in for 3 to 6 months, help stabilize the situation, get you on a path, and then you can continue with the provider of your choice. We're meant to be like your little extra supercharge of your plan. And then you can stay with us long-term, because some people don't have anybody. And so they can stay with us long-term, or they can continue with their existing providers. As far as working with us, well, there's 2 things. The first one is not behind a paywall. And so I want to say it first, because you do not have to have money to access all of this information. I'm on all the socials except for TikTok, but I'm on all the socials. But my Substack is full of like science. It's nerdy. Like it gives you science, it gives you full essays. I post notes multiple times a day that they're not just all hot takes. Like there is science in there. There's things that you can really advocate for yourself. You can pull out your own testing, and I'm updating that daily. So that Substack is either under, you can look up my name, Alex Mufson, or the articles are under my publication, Everything Looks Good. So you can check that out. That's free, always free. I don't intend to paywall that ever. If you'd like to work with us, everyone starts with a full circle evaluation, which is you bring all of your existing test results and all of your story. You have an interview. I personally do a deep dive into all of your records. It's under $500. It takes 2 weeks or less, and it gives you a 30 to 60 page evaluation. Like it's very long, and then usually a 10 to 20 page actionable protocol. And if that's all you do with us, awesome. Take it back to your provider, advocate for yourself, say, this is the information. We also include a provider synthesis, so you can cut out 5-7 pages of it that are written in doctor speak, and you can say, read this. And if your provider's not willing to listen to what you're advocating for, that's the indication that you need a different provider. If you stay with us, we have a variety of packages, all the way from like me just doing your health strategy work, all the way to you working with our complex trauma strategist or bioadaptive regulation specialist. And then we can offer peptides and some of the medications in-house. But like I said, we don't prescribe antidepressants or things like that, but we do prescribe really interesting stuff. So if you'd like to keep that in-house or your doctor says no, we got you.
Well, I really, really appreciate that. I think this is going to help some people for sure, this
I hope
episode,
so.
even just opening up their minds to realizing how in-depth this can be. And I think there's a fine line, and I think we hit it where we're opening that up, but not in the sense that it's overwhelming. And I love that you have so many levels of support as well. So
We don't want this to be inaccessible. Obviously, I believe in paying people really well, so we have to pay our team. They're specialists, but we have many levels of support to try to fit every budget so that you can get this information. This is my life. This is my mission. And I want as many people to have access to it as possible. So this is way more than a job for me. So if you're listening to this and you feel like you've done everything and you still don't feel well, I promise you there is something that we can find. And I will also promise that I'm a dog with a bone. So I will not stop until we find something to improve your quality of life.
that's amazing. That's going to give a lot of people hope. So thank you so much for bringing that to us and
Thank
being our
you.
guest today.
Thank you so much for having me. And thank you for the work you do. It's really important.
Thank you. I really appreciate that. I totally agree, because when people are suffering, whether it's from
Yeah.
these chronic gut issues or these kind of random mysterious
Mm-hmm.
symptoms, it affects everything.
And we need high-powered, incredible, in particular women, to be functioning so that we can be changing the world for the better. So this has ripple effects.
Isn't that the truth?
Yeah. Well, thank you so much.
You're welcome.